Hello and welcome to Reed Scholars Live. I'm your host, Mary Fleming, and current president of Reed Scholars. Today I have with me Josh Liu. Josh Liu is originally from Toronto, Canada, and completed his medical degree at the University of Toronto. He describes himself as a physician turned entrepreneur and is the co-founder of Seamless MD. Seamless MD is a platform designed to improve patient engagement, remote monitoring, and virtual care. Welcome. Thank you for joining us today, and we'll get into Seamless MD a little bit more in the future of this podcast. But I wanted to just briefly introduce people to you and ask a little bit more how you got into the technology space.
Well, first of all, Mary, thank you so much for having me. I'm thrilled to be on your podcast, or really your show. So, yeah. So my quick story. So you're right. I started off in the clinical world in medicine, and I think unlike a lot of my colleagues going through training, I didn't know what type of physician I wanted to be. But I had some fantastic mentors at my hospital who got me really interested in quality and safety.
Mm-hmm.
I ended up spending a fair bit of time doing research on hospital readmissions. I was actually part of this really interesting innovation center. It was called the Center for Innovation in Complex Care. And basically, it was an interprofessional team of clinicians, designers, and engineers who actually worked together to re-engineer models of care for the most complex patients who end up costing the system the most dollars. And my mentors got me really hooked on how do we prevent readmissions for these patients, so readmissions for heart failure and so forth. And at some point, I got really interested in technology and how we could leverage that to better engage and monitor patients, when they weren't in the hospital, so we could prevent something like a readmission. And long story short, in my last year of med school, I met some brilliant engineers and decided to actually start Seamless MD to help initially solve readmissions. And got my MD, got into residency, but actually had the choice of going full-time on the company, going back to residency, doing maybe 50-50 of both, but ended up deciding to go full-time in the company because I didn't think I could do two things well. I thought I could only do one thing really well. And so I ended up actually focusing on Seamless MD full-time, and it's been my full-time gig ever since.
That's exciting and really impressive when I hear stories of, there was a strong pivot, right? A pivot. Because we have so much to offer to different aspects of health and healthcare, and clinical medicine is not the only way that we can contribute as physicians. So I was excited about your story. I'm excited about, the technology aspect, the startup aspect. And, as from a health equity aspect, we talk a lot about making sure that as we build things, there's a health equity lens to it. And when we talk about health disparities, we often think about quality. And so I thought that was a great opportunity for us to learn more about that process and understanding how you build something from the ground up in the technology space. And it also gives us an opportunity to explore, possibilities of making sure that how we can be involved in that type of thing. So my next question, I think, for you is specifically around quality, because that's kind of where your original passion. With developing this type of technology, how do you make sure you engage patients on a broad range to address? I mean, we can start with readmissions, but just take us through that process.
Yeah, actually, if it's okay with you, I'll even start further back in that process.
I like it.
For us, it's about accessibility. So one of the things that we've learned is that, patients can't access the platform or the content of the platform, then they can't engage with it. If they can't engage, they can't provide data on how they're doing. And then if there's no data, then you can't monitor them. So it always starts with access. And I think, one of the things that I feel really fortunate about is the fact that there's a very strong clinical component to the team at Seamless MD. And I think the team composition really determines the type of solution that we can provide to our providers and patients. So about a quarter of our team is actually clinical in terms of being from medicine or nursing, pharmacists, dietitians, or health literacy backgrounds. We actually Denise is our fantastic director of patient education. So she actually has decades of experience leading patient education at academic hospitals And so when she joined our team early on, it was really important to her to make sure the platform was accessible in different ways. And so for us, that means number one, being accessible for many different vehicles. So, not just available on a smartphone or a tablet, but also available through a desktop browser as well. And I'll tell you a quick story. Early on when we would sit down next to patients and actually watch how they interacted with the platform on their devices, I remember, sitting next to an 80-year-old patient, and she had her iPad. Her iPad was, carried with her everywhere. But you realize quickly that she doesn't know her iTunes password. She can't download an app on her iPad,
Yeah.
but she uses email. She uses the browser. And so for her, the web-based version of Seamless on her iPad was what worked for her. And so we realized early on, you have to reach patients in the way they expect to be reached, and we can't have assumptions about it. And then even beyond just access to technology, within the content of the platform, Denise and her team have done a great job making sure that all of the instructions and the content on the platform meet guidelines for things such as being at the grade 6 reading level or lower. The platform is designed to meet accessibility guidelines for technology. So there's a whole host of these digital guidelines. It's called the WCAG guidelines. And so it's things around making sure the platform has been colorblind tested, contrast tested, a certain font size that we know we need for certain patients. It's even screen reader accessible, so patients can actually have it read out to them, the content. So there's all these little things I think often as clinicians we don't think about in terms of engaging patients, but for patients who have barriers to accessing content, it's so important. And I think that's been a key reason why when we engage patients on Seamless, we can actually drive an outcome because we've designed the program in a very evidence-based, patient-centric way so that it's very usable for them in the first place.
That makes a lot of sense. And I think it's important, to your point, just to kind of repeat that when we're developing this technology, you want to involve clinicians, right? So people who are going to be interfacing on the medical side, but I like that you also went with the patients and to see how they were going to access it, because it's not just do you have it, but can you use it, and right? And so that's huge. The other point I wanted to just have you speak a little bit more was the health literacy piece, and now I think, what are we saying, the telehealth literacy piece? And so, it's not just making sure that it's at a level which that people can read and access and understand. But I know you spoke to me a little bit more about tailoring it to even certain populations. And so once you go into a community, you figure out what that community needs. So it may be, if you will, we can use it like a dialect, right? So how we say something in New York versus Kentucky versus Mississippi, same words or same context, same language, but how we use the words, it might be different. So I'm assuming there's some amount of that in the technology space as well.
Yeah, definitely, and in different ways. So, I mean, for one is, even though we call them, template digital care plans on the platform for different surgeries or health conditions, so that there's pre-built content in there, but we always work with clinicians to customize and configure it for, what makes sense locally for your healthcare team. So that could be what makes sense clinically. Maybe your protocols are different, but also to your point, the terminologies that your patients and your demographic are used to. So, for example, we do work with the University of Alabama at Birmingham, and in their local population, they needed the reading level to be down, I think, to a grade 4 level. So we made sure that we decreased that even further. And actually, they did an evaluation of the data where they looked at they have a validated health literacy survey that they had patients do on the platform to gauge their health literacy level, and then they correlated that with the level of patient engagement with the platform in terms of how often patients use the platform, checked in, looked at stuff. And they actually found that there was no major difference between literacy levels and engagement with the platform. And their hypothesis is that because we invested the time to make sure it was accessible from the literacy point of view, that engagement was equally high among all those groups. So definitely we found that you do have to tailor it to the local demographic.
I like it. I think that's important, and I applaud you all for thinking about that and being willing to be customizable. The other question I wanted to ask is, or it's not a question, but Can you take us through kind of how the platform works? So you go visit, your doctor for XYZ, you get this diagnosis, and then you engage with Seamless MD. So just kind of take us through the steps so people can kind of understand how the platform works and how it might be beneficial. Um,
Absolutely. So maybe it's okay with you. I'll kind of tell you what's the normal situation for a patient and kind of what's different when we work with providers. So the modern day story is, let's say you're a patient having a major heart surgery. Preoperatively, you're given all kinds of instructions verbally or on paper, and patients will tell us that they forget those instructions, they lose them, day-to-day reinforcement, and so compliance isn't great. And as a provider, we have no easy way to monitor how a patient is doing, particularly post-discharge when they're recovering at home. And we often feel that it would be better if we could keep track of how they're doing so we could catch a problem earlier. And so ultimately, patients have higher than expected, recovery times and higher than expected visits back to the ER or being readmitted back to hospital. And so in a Seamless MD world, a patient gets access to our platform, let's say about a month before they have a surgery or they're admitted. And it basically on their phone, their tablet or computer, it guides them step by step through that care plan for that condition of surgery. So let's say preoperatively for heart surgery, they're getting reminders of, when to do certain instructions, when to stop, blood thinners on time. They're getting education about what to expect in their surgery. And then actually, even when they're in the hospital recovering, every day they're getting education or reminders about here's what to do on day 1 or day 2. And then they actually start tracking how they're doing in recovery. So they're actually tracking each day what their pain levels are, nausea, how far they can walk every day. And then the program actually gives them feedback on if they're on track or off track. And so if they're on track, it motivates them saying, hey, great job, you met these milestones in recovery today. And if they're off track, it says, hey, you know what, you didn't do your breathing exercises. Here's why you should do them today. Here's how to do them. And then when they go home, it continues for, let's say, the next 30 to 60 days where they're continuing to track, their temperature, maybe their heart rate. For surgery, we're often having them track their incision photos so that someone can keep an eye on it. And on the provider end, they can get alerts and dashboards to monitor patients. And so by actually keeping the patient engaged with their care plan, we've been able to shorten length of stay, by 1 to 2 days because patients are more compliant with the steps. And then by allowing providers to monitor patients when they go home, we've been able to prevent, readmissions upwards of 70% because now someone's actually having an eye on you and they're able to say, okay, this patient's showing signs of risk. Let's reach out sooner, bring them back in or deal with an issue remotely. And they've been able to prevent visits back to the hospital or readmissions. But I would say particularly now in the COVID-19 environment, we've gotten a lot of feedback from patients and providers that being able to manage these issues remotely and prevent unnecessary visits back to hospital has made patients feel safer and has made providers feel safer too. So I think what we're finding is that COVID-19 is actually going to accelerate the adoption of these types of tools so that way patients and providers can stay in contact, but also safely.
And that was going to be my next question, and you answered it already. So I was going to ask about COVID-19 and had that changed anything, and whether that was going to be introduce any challenges or provide any new opportunities. And so, we know that because of this, we've been interacting with telehealth and digital health technology at a higher rate than we had before. And so being in this world, you have a little bit of a better, I guess, ear to the ground than some of the other ones. Some of the other of us do. So, but what do you think about going forward? Do you think that's going to introduce any challenges long term, or you think it's all opportunities for innovation?
I think initially this year there were some short-term challenges when COVID-19 was first happening. So when it first happened, and it was all hands on deck. It was more difficult for organizations to, let's say, introduce new innovations in technology in the middle of all that. So, I think video visits, were picked up faster. I think that's a bit simpler to implement for something like ours. I think there was a little bit of a pause earlier on this year when they were just trying to figure out, what to do in the hospital with COVID-19. But now that we find most organizations have a new norm, they figured out their workflow, they're more prepared. now they're saying, okay, in this new COVID-19 environment, we need technologies like Seamless MD to actually be able to manage patients remotely long term and keep them engaged. And I mean, I'll to get your take on this, Mary, as well. Providers that I've spoken to have said, hey, you know what? These changes, this new norm of patient care inside the health system, it's going to last indefinitely. People don't believe, at least I've spoken, don't believe it's going to go back to the way it was. And so if that's true and there's a new norm, then I think technology is going to continue being an enabler to help providers better support patients in the new norm. I'd be curious to know if that's what you're hearing as well, but that's definitely what I'm hearing with my ear to the ground.
Yeah, I think it'll be hard to go all the way back. I think, everything is a pendulum, right? So we swung all the way over here because we had to. But I don't think we're going to swing all the way back. It'll probably adjust somewhere, probably off center towards more digital space. I think the thing that we've been talking about, especially in the health equity space, is that as these digital technologies become available, making sure they continue to be accessible. And in addition to the actual physical technology itself, a lot of people have been talking about access to broadband, Wi-Fi, and that type of technology, so that we know that, even if you're, in an urban situation, but can't get to the hospital because of transportation, or you're in a rural situation and can't get to your clinician because you're 3 hours from the closest hospital, how do we make sure that those vulnerable populations are continuing to have access to the new technology that we have? But I think that's the way we're going, and we just have to figure out, how to make it work. So not to switch gears a little bit, but just because I don't want to keep you too long, like we started this, I think it's so important that we realize that in the clinical space that we have so much to contribute to other spaces, and technology is one of those. So for our potential mentees, right, coming up behind us, what is your advice for getting involved in this space, and whether you want to be involved in this space full time, like you jumped in 2 feet, or if you want to be involved, in a consulting role, or just learning more about, digital health? What's your advice to people coming along, and how they get introduced to this space?
Absolutely. I think the advice I always give is to just follow your curiosity. I run into a lot of folks in clinical who want to get involved in technology or business or digital health in general, and they always ask me, what should I do, or how do I find a great idea to work on?
Right.
And I've always believed that it's important that you just follow your curiosity and just pursue interests and learn about topics and areas, and then the right problem area, the right topic will pull you. You'll gravitate towards it. So for me, I was just so obsessed with. I mean, I could tell you stories about how I would be up at 3 a.m. thinking about Reede mission. I know it sounds corny, but it was true. I think it was important because when you start a digital health company, or any company or organization in general, if you're not obsessed with the problem, when times get tough, you're going to quit, right? And so I think it's more important that you find something you're incredibly excited about, and you keep wanting to learn more about it, so that way when times get tough, you don't quit. So I would encourage people to just keep reading, listen to podcasts like yours, find topics you're interested in, and then research organizations, groups, or people who are doing that type of work, and then contact people, get involved. I think defaulting to action is really important as well. So more important than people kind of just asking, let's say you or me, hey, do you think I should try doing this? I would say just go try doing it. It's okay if you end up not liking it.
Right.
So I love the fact that, with like Reede Scholars, I'm assuming you just started this podcast one day, right? I don't think you asked permission from anyone to start a podcast. You just said, I'm going to start this podcast. Is that fair to say?
That's fair to say. That is fair to say.
And here we are, right? Here we are.
So, I like that. I think that is a great place to end. Default to action. So, but I appreciate you joining me and having this, very interesting conversation. I love learning about Seamless MD. And like I said, I'm very fascinated about, using our clinical skills in non-clinical areas. So that's very inspiring and encouraging. I look forward to see what else you do. I think you are in a great leadership trajectory, so look forward to following your career as well. If you ever want to come back and talk about something else or this some more, you let me know. You are always welcome to Reed Scholars Live, so appreciate it.
Thank you so much, Mary. Now that we know the invitation is on the record, I'll have to take you up on it.
Fair enough, fair enough. Thank you for listening to Reed Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.